Here is a kind of knee trouble that almost no one explains to you. Your knee is stiff, not just painful, stiff.
All right, let's try this.
It will not straighten fully. In the morning, it takes time to get going. After sitting, the first few steps are tight and slow. And slowly, over months, the knee seems to be settling into a bent position you cannot fully undo. That is not the cartilage, that is not bone rubbing. That is two parts of your knee almost nobody talks about: the lining and the capsule. And for many of you, what is damaging them is sitting in your blood. Pain gets all the attention, but stiffness has its own cause, and it lives in the lining and the capsule, not the cartilage. Inside your knee, there is a thin lining called the synovium. One of its main jobs is to make the fluid that lubricates the joint. The natural oil that lets the surfaces glide. In a healthy knee, that fluid is thick and slippery. It cushions, it protects. But when the joint becomes arthritic, the lining changes. It makes a thinner, poorer fluid, less of the substance that gives the oil its body. The lubrication drops, and the same inflamed lining releases chemicals that irritate the nerves around the joint. So the lining can be a source of pain even when you are sitting still. Chemical pain from inflammation, not from movement, and it is making worse oil at exactly the moment the joint needs better oil. Around the whole joint, there is a tough bag called the capsule. It holds the joint together and keeps the fluid in. When the capsule is healthy, it is supple. It lets the knee move through its full range, fully straight, fully bent. But the capsule can stiffen, it can thicken, tighten, and develop what we call a contracture, a shortening that will not let go. When that happens, the knee can no longer fully straighten. It settles into a bent position, that is the flexion deformity. Some of you can feel developing, the knee that quietly stops straightening year by year. The knee that cannot straighten loads itself wrongly with every step, which feeds the whole problem forward. A tight capsule is not a wear problem, it is a fibrosis problem. The bag around your knee slowly shrinking and hardening. So, what makes the lining inflamed and the capsule tight? For a great many of my patients, a large part of the answer is in their blood sugar. When blood sugar runs high for years, even mildly high, the kind many people do not know they have, it generates what are called free radicals. Think of them as sparks. A steady shower of tiny sparks landing on the soft tissues of the joint day after day. Those sparks do two things. They keep the lining inflamed, and in the capsule they drive the tightening and hardening. The fibrosis that pulls the joint into stiffness and contracture. This is why people with diabetes and people heading towards it get so much worse joint stiffness than others. It is not bad luck. It is the sugar in the blood quietly working on the lining and the capsule. High blood sugar does not only threaten your heart and your eyes, it is stiffening your joints with a steady shower of sparks. Now think about what this means for how a knee like that should be treated. A treatment aimed only at the cartilage does nothing for the stiff capsule or the inflamed lining. A new joint replaces the surfaces, but if the sugar is still running high, the same process can stiffen the tissues around the new joint too. This is why before we treat any knee, we look at the blood, the sugar control, the inflammation, the whole metabolic picture. Because if that is what is stiffening the lining and the capsule, then no injection and no operation on the surface will fix what the blood is doing underneath. You cannot loosen the joint that the body is actively tightening from within. Not until you turn off the sparks. But the blood is only half of it. The lining I described, that large inner surface that makes the fluid and carries the inflammation, is also the main place a biological treatment can reach when it goes into the joint. It is the biggest surface inside your knee. So the part of the treatment delivered into the joint space, the platelet preparation and your own fat-derived cells, is aimed squarely at that lining to calm where the inflammation is actually coming from. When the metabolic correction turns off the sparks feeding it, the surface inside and the sugar in the blood addressed together. The full reasoning and the markers we check are explained in our 12th April video linked below. So if your knee is stiff, if it will not fully straighten, if the mornings are slow and the joint feels like it is closing down, do not assume it is only the cartilage wearing out. Ask about the lining, ask about the capsule, and ask whether anyone has looked at your blood sugar as a cause of the stiffness, because it may be the most fixable part of the whole picture. The stiffness has a cause. Often it is in your blood, and what is in your blood you can change.